Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation.
Okay, we're back. Hello, Roxy.
Hey, Megan. Good evening. How are you?
Good. We're coming back to do another episode on men's health to finish off Men's Health Month. I keep wanting to say it's like May is Men's Health Month, probably just because it both starts with an M, but we are in June. We are cruising through June. So, Roxy, tell us something good.
Gosh, I shouldn't have to think that hard. You go first. Sorry, I should have been ready.
It's funny because I was thinking about this earlier, well, like right before we got on here, and it's like my brain is tired, and I know it's like I shouldn't have to think this hard about it because there's a lot of good things happening. I would say we just had this last weekend, so this episode will come out a few weeks after it, but we had our clinic 3-year anniversary, and we had a little event at the clinic with vendors, and it was a lot of fun, and we had a good just steady flow of people, and we had this ear piercer that was there, and my mom and Grace and I all got our ears pierced. I haven't had my ears pierced since probably middle school, and I was like, oh, that's what that feels like again. So I'm rehabbing my ear. And, but yeah, it was a good time. And so we did that. And then the next day we had my son's birthday party. And so it was just a full weekend. Yeah. All right, Roxy, you ready? Tell us something good.
I'm ready. I think it was a couple weekends ago, I went to this little retreat that's so lovely. It's like a wellness retreat, kind of, that some friends from undergrad that I know would put on. And if you can believe this, it's in the middle of Nebraska, but it's lovely. They have a beach on their pond, and we get massages and facials and all these things, but it's just all about resting and caring well for yourself and whatnot. If you want to check it out, it's called Simply Well Retreat, and it is lovely. It's the best 24 hours that I spend on myself, probably the whole year. But anyway, there was a speaker there that really challenged me in a lot of ways to pick a goal, like a wellness goal of some sort. And I've been struggling to drink water just to get dehydrated. And so I challenged myself just to drink the amount of water I need to every day, basically. And I'm sticking with it. I'm proud of myself. So it's so silly, yet it's one of those things where almost humiliating how simple of a goal that was that I wanted to, and I wanted to write. It was all about slowing down and of living in the present and how healthy that is for our body and whatnot. And then yet, there was these challenges of think of a goal. I wanted to think of 5 goals. And it's no. That's not the point. The point is be realistic and simple and have it be life-giving, right? So anyway, but yeah, I was very humbled at writing my drinking water goal, but it's something I really struggle with. And so anyway, I'm sticking with it so far, and I'm not super legalistic with it, but just, it's funny when you write something down or you say it out loud or whatever it is that it means something then. And we all know we're supposed to drink water, be hydrated. But anyway, that's my something good.
Sometimes when it's just the one thing, it makes it a lot easier.
Oh, yes. Yep. I would have failed miserably by now if I would have left there with 5 goals like I thought I should.
Yes. Okay, well, this episode is going to be kind of a episode on rebuilding strength and confidence after having a prostatectomy. So the removal of the prostate. And there could be different reasons why maybe a male would have their prostate removed. But we're going to talk a little bit about that. And hopefully it'll shed some more light on the whole process. So we all know probably some male in our life that has had issues with prostate. And there are some pretty amazing statistics that Roxy's going to share with us And so we'll just jump right in and get everybody a little up to date on prostates.
Okay. So basically, with a prostatectomy, like Megan said, it's the removal of the prostate. That's usually because of cancer, or if there's a high PSA number, then there's some different options you can go with. You can do radiation, like real localized radiation to the prostate is another common one. But when what we're talking about tonight is when men have made the choice to have the prostate removed. Most common symptoms that men are faced with are typically like urinary incontinence, and that can either be like stress or urge. A lot of times these guys, and we'll jump into kind of why some of this is, but sometimes they don't even feel it, like just kind of stand up and it leaks out for a little bit, and so it's not always just like coughing and sneezing type of things, but sometimes there's if they just don't feel it or they don't feel the urge. There's a high prevalence of erectile dysfunction. There can be some pelvic pain with that. A lot of times just post-op, that's uncomfortable, but then that can then last longer than it needs to. And then just like loss of confidence, identity, for a lot of these guys, this is maybe one of the first instances that they've had people in and around, their penis and their scrotum and like talking about all these things that are really personal. And so that just is extra humbling, like uncomfortable, and just a reminder that this sucks kind of. And so there can be this big, like, just there's a shift in like, oh, I'm not as healthy maybe as I once was. I'm not as young as I once was. Things are different. I'm talking about things I don't want to talk about. So anyway, but what happens a lot of times that I see is that men go in for some reason, somehow they're alerted that they have, prostate cancer. And so in the same visit, they're getting this kind of bomb dropped on them of like, you have prostate cancer. Here's what we can do. And they're committing then to having their prostate removed. And it's not that the urologists intentionally leave all this out. It's just to literally like drop everything on them in that visit is a lot. And I think those guys come into my office, at least what I've experienced, and are just kind of like in a daze of like, yeah, this is happening. They explained it, but like I think it's just a blur sometimes that those visits are. And so they don't actually understand what's happening. They don't know all the symptoms or the complications or what this actually means. It can be really a confusing time, and it's not lack of care at all, in my opinion, from the urologist. It's just they're dropping a lot of things on them and they're making some big decisions. And some of these details in the moment don't feel as big as like you have cancer. And so they don't get discussed as much. A lot of times too, I think then what happens is they come in and they don't know a lot of the details, and there's a lot of misunderstanding of what's actually happening. And then if they do have symptoms, it just feels like part of recovery. And then when those symptoms don't go away, then they're really confused too. And so just giving it time and that the body's going to heal isn't always the case, unfortunately. It's really important that this population of patients gets early education so that they know what to expect, they aren't surprised, and then that we give them the guidance to navigate these new symptoms after surgery.
Yeah, and I think, the education piece is so incredibly important. And we see a lot of times where it's just maybe we see these patients after they've had their prostatectomy. And so before I kind of talk about the prehabilitation before surgery, Roxy, tell us the stats that you have for prostate removal.
Megan's going to jump in and talk about what we need to be doing before that surgery happens. But the stats are impressive. And so men who do pelvic floor muscle training before their surgery, before their prostatectomy, they have 50% less urine leakage at 2 weeks post-op. So you cut your symptoms in half by working ahead of the game, which is huge. Like that's just an impressive stat to me by itself. But also those same men who work ahead of time, they have a 74% chance of full continence, so zero leakage. They have a 70% chance of no leakage at 12 weeks post-op. And that's really impressive too. And so anyway, just thinking about, man, these are good numbers. These are numbers that we can do something about, right? And it all comes from working before the surgery. And so Megan's going to hop into what that looks like.
All right. So, yeah, let's talk a little bit more about the prehabilitation piece of this. So, this is the goal is to educate and strengthen before surgery. And that's where the prehab comes in. So, we're teaching during that time proper pelvic floor activation and not like an overactivation. And here's the thing, I would much rather be teaching somebody how to find their pelvic floor and be able to contract their pelvic floor before they go into surgery. Because after surgery, there's discomfort, there's fear, there's all these different factors. So when we can be teaching this before you go in, you head into this with confidence, knowing, okay, now I know how to find these muscles and it's going to be easier afterwards. So, an equivalent to this is why we love seeing women during pregnancy early on. They know how to find their pelvic floor muscles. We'd work continuously to find those pelvic floor muscles and work those through pregnancy. And then maybe towards the end of pregnancy, it's like, oh my gosh, these muscles are so stretched. It's so hard to contract them, all this stuff. But guess what? After you have the baby, it's very easy to find them again because you've had this muscle memory. And we've been working on this over these months. So, kind of that same thing when it comes to prehab with men with pelvic floor. So, we're going to be teaching how to activate pelvic floor, emphasizing like bladder and bowel awareness, maybe bladder diaries, that sort of thing. So, benefits of this is shorter time to regain continence afterwards. We're going to have this empowered mindset, and it can be a really powerful time. And it doesn't take too many sessions prior to the surgery to just get the stuff laid down, get going on it, which is great. So that's kind of that prehab phase. And then, Roxy, I'll let you kind of talk about like those early recovery and like progression pieces.
And I think I would add to that prehab is a lot of times what happens is men don't have any symptoms, beforehand, but the mechanics of their body aren't sound. So a lot of times they're bracing with a lot of pressure, or they're holding their breath or different things like that. And we can identify this beforehand. And even though there's not symptoms, we know confidently that surgery is going to put them at a disadvantage. And if we're putting a ton of pressure down on the pelvic floor after surgery, that if those mechanics aren't sound beforehand, then there's a higher likelihood of leakage. There's a higher likelihood of like pain and different symptoms, but that leakage is huge. And so that's really what we're trying to push in that prehab is saying, look, you don't have symptoms now, but we know your body's going to struggle here in a couple of weeks or whenever their surgery's coming up. And so we want to give it an advantage, teach it how to do it correctly, because you're going to want every advantage that you can when it comes post-op. So that's, I think just a big piece is most of those guys aren't symptomatic. They're kind of like, why am I here? What's going on? But that's a big piece is we can identify problems before they even happen. And that sets them up then for better success. So what happens is with that surgery is when the prostate's removed, they have to connect the urethra. A catheter is inserted while that heals, basically. And so for 2 weeks, usually it's about 2 weeks, guys have a catheter in. Well, the problem with that is then the one, your anatomy is different, but two, we've held that sphincter open for 2 weeks now. And so we take that catheter out, and that's where that, some people might think 50% leakage or, at 2 weeks. It's like, no, that the body's so confused because one, the urethra is a different length. And two, that sphincter's like dazed and confused. Like it's just been chilling here for 2 weeks and it doesn't know how to function. And so even though it has the capability, it's all this coordination and timing challenge that happens. That is just a huge piece to know. So we start this retraining then after that catheter's out, because not that we can't do a lot. We're still working pressure management. We're still working body mechanics. The first 2 weeks that we learned before surgery, we taught before surgery, but that recovery really happens. We're retraining those muscles once the catheter's out, and now it's go time. Those muscles have to start working. But that can be a big shock because that's when a lot of leakage typically happens. Our emphasis then is on these gentle and effective pelvic floor muscle contractions that we ideally taught before surgery. And so, like Megan said, it's familiar, even though it's weird because that catheter's been in there and things are leaking and it's kind of a mess here and there. We want to teach that beforehand so then we can jump right into that early post-op season. A lot of times we're just doing this either like laying down so that we don't have that extra pressure of gravity. Sitting can be helpful because we have the pressure of the seat to kind of help out the sphincter there to hold so that it's, not leaking out. But it's a coordination piece. These guys don't lose all their strength in a couple weeks because they're still walking around and moving. That sphincter's confused and the timing is different. And so that's the key here is to retrain the muscle how to time and coordinate how fast to squeeze, how much to squeeze after the anatomy's changed and the catheter's been in there for 2 weeks. So we're also working on breathing coordination, and that's just a big piece with intra-abdominal pressure. A lot of times guys are holding their breath. And so if we can work on getting them to breathe out so their core engages, their pelvic floor engages as they're standing, things like that, that's a huge piece because if they're holding their breath, then that's pushing urine out the bottom. And we're talking about this beforehand, hopefully. That's a big piece of it. And when they really understand that, then it makes sense. And we can, within a couple visits, like cut their leakage way, way down by just implementing a few of these strategies. And then looking at the bladder urgency, a lot of times if they're leaking, they feel that urge. And if there has been a leak with it, then there's a fear with it. There's a concern, there's a nervousness, or they're like wanting to go all the time, or if they're out in public or doing things like going with friends, whatnot, there's this urgency that can happen and develop and stay really chronic because of that fear of leakage. So they're wanting to just empty a lot more so that they don't leak. But then that can fuel really bad habits that just are unhelpful, obviously. And so we're working on building confidence and teaching the brain to be in control of the bladder instead of the bladder being in control of them. And so we're teaching them, to really be objective with that. If some of the things Paige just talked about a couple, last episode and the episode before, that's what we're doing here is saying, no, like your bladder can hold that. Let's teach it, give you confidence. And then it's really fun to kind of see that progression go. And then we're just avoiding compensations that we know happen and that we see. The inner thigh gripping, glute gripping, breath holding, those types of things that fuel leakage and put more pressure down on the pelvic floor that's trying to figure out how to coordinate this new anatomy, this new body, basically, this new part of the body.
I think that that's such an important time. It's just a powerful time to where if you're working with somebody, it can be very encouraging. And like Roxy, just you mentioning, the fear behind it and that sort of thing. It's a lot to take in after you've had a surgery and you have a catheter and all that business. So, okay. So after you kind of go through those early phases of recovery, obviously we're always assessing how somebody's doing. Like Roxy mentioned, you're kind of in like laying down, hook lying, anti-gravity positions. But through that, we're working into doing these in sitting. Then we're progressing these into being upright and standing. And everybody's so, they're different on their progress. But then we start just like more like load bearing, more loading the exercises, functional pelvic floor integration into things, with like walking and squats and coughing and lifting and those sorts of things. If some men have like gym specific or want to return to sport, golf or something like that, starting to incorporate some of those sorts of movements into rehab, which can be, really fun and exciting for men to be able to realize like, okay, we can do this again. And then of course, through that time too, that's when we might have to be addressing, things along the lines of like erectile dysfunction and talk about like different things we might have to use. And that's like, could be like a whole nother episode as far as like vacuum devices, just like medications with urologists, TENS units, that sort of thing. But I think the biggest thing for us to remember in this is, when the prostate's removed, we lose that bulking around the urethra. And that's why we need to focus so much on the strengthening of the pelvic floor in these guys, because now we need more bulking through the pelvic floor, because now it's the muscles and the external urethral sphincter that is providing that sort of support with like urine control. So that prostate is no longer there. A lot of times we just don't really think about this in fellas, that we need to be like, and not a lot of guys you can go up to and be like, do you know how to do a Kegel? And so it's finding those muscles without them sitting there and doing a glute squeeze, like Roxy mentioned, and the compensatory kind of strategies. So that's kind of how you go through those phases. And obviously, you just want to help return your patient or your client, whatever you want to refer to them as, to their, like optimal, like functional activities in life and being able to, move through this. So, healing time is different for everybody and just depends on, multiple factors, just like anything else. Having somebody to work with where you can hold space for also like the mental and emotional healing through it and just like normalizing some of the anxiety and fear during the post-op phase and normalizing kind of the grief that might come with changes to the body. I know that in our clinic, the guys that have come in and seen our therapist that treats men, the outcomes are always they're obviously across the board, we have really great outcomes. But there's just something special about those guys coming in where we've mentioned in our last podcast, they've maybe seen 4 or 5 doctors before coming into pelvic floor therapy. And it's so powerful because a lot of times what men are going through can have very high success rates with pelvic floor PTROT. We should be seeing more referrals for prehab before having your prostate removed than we do. And so I think that's like, I always scratch my head on it because I'm like, why are we not having like 2 sessions before surgery? So hopefully maybe we could spread the word this month for Men's Health Month we need to put a big old blast of that statistic that you reported earlier, Roxy.
Yeah. Well, and I have a couple really good doctors that do send ahead of time. And it's exciting on
Oh,
my
that's awesome.
side to see because I do get to work with a lot of guys beforehand. And the best is when they come in at 2 weeks post-op and we've worked on this ahead of time. And even if it's not perfect, coming in and it's like, I don't ever know what I'm going to get. We don't know after that surgery. And that's why I
Yeah.
tell them, like, we can't promise that you're going to have no leakage. And some people get that catheter removed and their body just kind of bounces back and things are good to go, But I tell them, it's just best to be prepared for, worst case scenario kind of. But it's so fun then when they come in and you can just kind of tell, like, they're like, let's get to work here. Like, here's what I'm having. Or, like, it's not so much like, I feel like the guys that I get that we haven't been able to work with beforehand, it's a little more doom and gloom of like, here's where I'm at, and it is that like loss of identity or that loss of confidence or whatever, where the other guys, they've put in some work on the front end and they're like, okay, like here's where I'm having leakage with this and this. And so we're connecting dots. And then, the next time they come in, they're like, okay, so I've made progress this way. But I can only really like be out in my garage tinkering around for maybe 30 minutes. And then I need, we see this progress and it's so cool then because
Yeah.
where they started and where they finished, it just is a progression. And so anyway, I love it when there's a couple doctors I can count on. They send me those guys ahead of time and it's just really neat to see that in its like best in an
Yeah.
ideal situation because we
Yeah.
don't always get that right.
Sure.
But just in that ideal situation to even mentally, I think just even mentally prepare them and give them tools ahead of time. And then they come in and it's like, it's not this big thing in their face. There's a lot more confidence and they're ready and they're upbeat, it's even though they're, having to wear maybe a briefer pad for a little bit, they're ready to just get back to life. And there's a lot more hope and optimism that way.
Yeah, absolutely. Well, so our key message here is pelvic rehab is essential
Mm-hmm.
for post prostatectomies. And don't wait for the symptoms to get bad enough. Just get in there, meet your therapist, build your relationship before the surgery, because there is life strength and sexual confidence after prostate surgery. So if you know somebody that would benefit from this episode, we'd love for you to send it to them, follow us, and rate us on the podcast on whatever platform that you listen to. We'd appreciate that. And until next time, we will keep this conversation going. We are looking forward to some fun guests coming up later here in the summer. And if you ever have any questions, feel free to send us a message on our Instagram. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.